Hello everybody, I'm Dr. Priya and I'm the Director of Kanaa Fertility Center and Bloom Maternity at K.K.Nagar, Chennai. I hope you're all staying home and staying safe in this lockdown period. இந்த கரண்ட் லாக்டவுன் பீரியடில் விமென்ஸ் ஹெல்த் பற்றி நம்மளுக்கு என்ன கன்சர்ன்ஸ் இருக்கும்னு பார்க்குறதுக்கு தான் we thought we'll record a short clip. I'm going to talk about 3 areas. One is pregnancy, one is fertility, and third is the need for contraception. First, coming to pregnancy, how has it changed நம்மளோட approach in this current COVID scenario ன்னு பார்க்கலாம். I'm sure a lot of you will have a lot of concerns about pregnancy because it is a very precious period in anyone's lives. So what are these common FAQs we should address? Are pregnant women more at risk for contracting COVID? illa. They are not the at-risk population inga. It is more those with comorbidities and the older people and so on. So they are not more at risk, nor do they have increased risk of complications from COVID. Second is, are there any risks to the unborn fetus? Current studies, இப்போ வரைக்கும் ஆன deliveries வரைக்கும் COVID has not affected your pregnancy or your unborn child in any manner. But having said that, it is still too early because இப்போ கரண்ட்டாக ப்ரெக்னென்ட் ஆகிறவங்க 6 months later தான் whether there are any effects on the unborn fetusன்னு நம்மளுக்கு கரெக்டாக தெரியும். How can we prevent transmission or how can we avoid contracting the infection? It is like for any other non-pregnant person as such. We have to stay home, practice social isolation, avoid large gatherings or where there are crowds of people, wear a mask and practice frequent hand hygiene. So these are the measures which will protect us from getting this infection as such. Is there any change in your checkup schedule? நீங்கள் எப்படி டாக்டர் கிட்ட போகணுன்னா once we confirm the pregnancy 12 weeks to 14 weeks time periodல NT scan எடுப்போம். Is the baby at increased risk of any chromosomal problems like Down syndrome ன்னு பார்க்குறதுக்கு? ஸோ அந்த ஸ்கேன் மிஸ் பண்ணாமல் எடுத்துக்கிறது பெட்டர் இஃப் பாசிபிள். அது முடிஞ்சதுன்னா டைரெக்டாக 20 வீக்ஸ் ஸ்கேன் வேர் டார்கெட் ஸ்கேன்னு சொல்லுவோம். பேபிக்கு எதுவும் மேஜர் அனாமலிஸ் இல்லைன்னு ஒரு உறுப்பாக பார்க்குற ஸ்கேன் அது பண்ணிவிட்டு டைரெக்டாக செக்அப் பண்ணிக்கலாம். ஆஃப்டர் தட் 32 வீக்ஸ் பேபி க்ரோத் வாட்டர் லெவல்ஸ்லாம் நார்மலாக இருக்கான்னு பார்க்க அண்ட் தென் த லாஸ்ட் மந்த். இந்த நார்மல் லோ ரிஸ்க் ப்ரெக்னன்சி திஸ் இஸ் ஃபைன். இன் ஹை ரிஸ்க் ப்ரெக்னன்சிஸ் தென் ப்ராபப்ளி இட் இஸ் பெட்டர் யூ go to the doctor as per the regular schedule because we don't want to miss any problems. Coming to the route of delivery, is there any change? Normal or cesarean-க்கும் இப்போ கோவிட் சினாரியோக்கும் ஒன்றும் சம்மந்தம் கிடையாது. The route of delivery will be determined only on your particular condition, size of the baby and so and how your labor proceeds. கோவிட்னால நிறைய C-section தான் பண்ணணும்னு எந்த அவசியமும் கிடையாது. போஸ்ட்மார்ட்டம் என்ன கன்சிட்ரேஷன்ஸ்? நம்ம ஊர்லேயே உங்களுக்கே தெரியும், நிறைய பேர் குழந்தை பிறந்தோன்னா தே கம் டு see the baby, friends, colleagues, family, relatives, everyone. ஸோ அதனால we don't want a lot of exposure of yourself and the baby to a lot of people where the risk of infection goes up because நம்ம ஊரில் asymptomatic carriers are more. So even if they don't have any obvious signs of infection, they may still be harboring the virus and you don't want to put your child and yourself at risk. So please avoid visitors for another 2 months at least. Other than that, breastfeeding, exclusive breastfeeding is still possible and is not going to be changed by this COVID scenario as such. Next, coming to fertility in பார்த்தீங்கன்னா most international and Indian societies had said we will suspend fertility treatments because they didn't want the couple coming back and forth to the hospital a lot of times and exposing themselves to the risk of contracting the infection as such. But slowly, worldwide, we are still in the process of restarting fertility treatments. So post-lockdown, you can go and meet your doctor about the further course of action and any IUI or IVF procedures probably you can think of starting it in June. But fertility பொறுத்த அளவுக்கு COVID does not decrease your chances of natural fertility in any manner. And there have been a lot of our patients who were on treatment and at home now, maybe இப்போ work at homeல இருக்காங்க, இல்லை enforced-ஆ வீட்லேயே இருக்காங்க, they are less stressed-ங்கிறதுனால, they have more time-ங்கிறதுனால we have had a lot of patients coming back with natural pregnancies itself. So it's always good to start trying on your own too in this current scenario. Third and the last one, the contraception. This is very, very essential because again in the lockdown situation, we have a lot of couples coming to us with unwanted pregnancies. Why go through unwanted pregnancy, அடுத்த abortion and medical pills fail ஆச்சுன்னா you have to have anesthesia, admission and a DNC procedure. இதெல்லாம் avoid பண்ணோம்னா please practice some form of contraception, either using condoms each time, every time without fail, using pills, which is very easy, and you can go in for telemedicine consultation with a gynecologist and start taking the pills on your own. இதுதான் ரெண்டு ஆப்ஷன்ஸ் in this current situation, because the third one, copper ங்கிறது again you have to go to the doctor. So please practice safe sex and avoid unwanted pregnancies. I thank Mr. Sundar and his team from Precision Pro Events for giving me this opportunity to bring across this message, and I hope you found it useful. Stay home and stay safe. Thank you.